Okay.
Will the Democrats consider reconciliation or breaking up the bill in some way to the point where you'd only need 51 votes to get it passed? Is that under discussion?
The bottom line is we prefer a bipartisan approach, and that's why both Senator Reid, our majority leader, and President Obama bent over backwards. You know, it was supposed to be done, the bipartisan bill, by June 15th, June 30th, July 15th, August 1st. They're bending over backwards. But at some point soon after we get back, if we don't have a bipartisan bill, we'll never be able to meet the goal of having a bill signed into law by the end of the year. So, yes, we are considering alternatives. They include just getting 60 Democratic votes and maybe an occasional Republican here or there on a bill. If we can't get a bipartisan bill, try as we might. They include looking at reconciliation, which only needs 51, and they include a combination. We are now looking at the alternatives because it's looking less and less likely that certainly the Republican leadership in the House and Senate will want to go for a bipartisan bill. John Kyle has said he doesn't want a single Republican vote for any health care bill.
On that point of bipartisanship, or the lack thereof, Senator Hatch, this is what the president said during an interview this week with Michael Smerconish in Philadelphia about what Republicans have made a decision about. Let's listen to the president.
I'm confident we're going to get it done. And as far as negotiations with Republicans, my attitude has always been, let's see if we can get this done with some consensus. I would love to have more Republicans engaged and involved in this process. I think early on a decision was made by the Republican leadership that said, look, let's not give him a victory, and maybe we can have a replay of 1993-94 when Clinton came in. He failed on health care, and then we won in the midterm elections, and we got the majority. And I think there's some folks who are taking a page out of that playbook.
Senator Hatch, is he right? For Republicans, is health care his Waterloo? Is that what they want to make it?
Well, I wouldn't call it that, but it's extremely important because what they're trying to do, you know, almost anything you look at, and you look at the two Senate and House bills. Number one, they demand a public plan. Whether you call it co-op plan or not, it's going to be a public plan, a government plan. Number two, they want employer mandates, which basically kills people on the lower end of the wage spectrum. They're either going to lose their jobs, be cut back in pay, or the companies are going overseas. And number three, they want to push people from private health insurance into Medicaid, right, which could destroy Medicaid.
But I'm asking about, Senator Hatch, I'm asking about tactics here. Have Republicans made the decision that if you beat them on health care, you can beat them in the midterm next year? And that's been the guiding principle.
No, that hasn't been an approach on the Republican side, but I do admit that I think virtually every Republican realizes that they want this government plan almost at all costs. And the reason they want to move the way they are is to move to a single-payer system like Canada's, Germany, France, whole England. Wow. Now, choose any one of those over ours, and I'll tell you, you don't know what you're doing. No. Our plan, as bad as ours is in some ways, and it does need reform, I've got to tell you, it's head and shoulders over any other plan, any other government in the world. But we need to work on it together. But I've got to tell you, they're insisting on these, I think, legislation-killing approaches that literally Republicans cannot go along with.